Welcome. Almost every medical error is preventable, and the person who prevents it is you at the cart and the bedside. In the next few minutes, we'll cover the simple, careful habits that stop medication and care errors before they ever reach a resident. The rights, the three checks, two identifiers, clear communication, and honest reporting. Small habits, big protection. A medical error is a preventable mistake in care, most often a medication error, the wrong resident, the wrong drug, dose, route, or time. When an error reaches a resident and causes harm, we call that an adverse drug event. But not every error gets that far. A near miss is an error caught in time before it causes harm. You, at the cart and the bedside, are the last and best line of defense, and most errors are stopped by a careful person who simply slows down and checks. Our residents are often frail, take many medications, and trust us completely. A single error, a missed allergy, a look-alike drug, a wrong dose can seriously harm someone who depends on us. Medication problems send hundreds of thousands of people to the emergency room each year, and most are preventable. The difference is almost always a habit, a check done, a label read, a question asked. Every safe step you take is a harm that never happens. Before any medication, confirm the rights. The core five are right resident, right medication, right dose, right route, and right time. Many teams add the right documentation, the right reason, the right response, and the resident's right to refuse. But the rights only tell you what must be correct. They're a checklist, not a guarantee. They work only when you back them with the real checks that follow. Check the medication's label against the order 3 times: when you take it out, when you prepare it, and right before you give it at the resident's side. Read the full label deliberately each time: name, strength, dose, and route. Those 3 quick checks take only seconds, and they're how look-alike and wrong dose errors get caught before they ever leave your hand. If anything doesn't match the order, stop right there and sort it out before you go on. The most basic and dangerous error is giving the right medication to the wrong resident. Prevent it with at least 2 identifiers every single time, like the resident's full name and date of birth. Never use the room number or the bed. Residents move and rooms are shared. Confirm identity before every medication, treatment, and procedure, not just once at the start of your pass. Some medications are high alert: insulin, blood thinners, and opioids. They aren't given in error more often, but when an error does happen, the harm can be severe. These deserve extra care, an extra check, and often a second person to verify the drug and the dose. Know which of your residents take them, slow your pace, and double check every time. Many medication names look or sound almost the same, and that confusion causes errors. Names like hydroxyzine and hydralazine are only a few letters apart, yet they're completely different drugs. The defense is simple: read the full label, every letter. Never grab a drug by its shape, color, or spot on the shelf. Watch for names printed with mixed capital letters that highlight the difference. And if two names are close and you're not sure, stop and verify with the nurse or the pharmacy. How and where you give medications matters as much as the drug itself. Treat the med pass like a quiet zone. Interruptions are a leading cause of errors, so if you're interrupted, finish the steps safely before you turn your attention away. Don't pre-pour, and never leave medications unattended. Always check allergies first. Never give a medication you didn't personally prepare. If you didn't pour it, you can't verify it. And document right after the resident takes it, never before. Many errors begin with a message that wasn't clear, so strong communication is error prevention. Give a complete handoff at shift change. A simple framework is SBAR: situation, background, assessment, and recommendation. For any verbal or telephone order or critical result, the nurse writes it down and reads it back to confirm it's right. And whenever you're in doubt, just ask. A 10-second question prevents a much bigger problem. If you see something unsafe or make a mistake yourself, report it right away, and that includes near misses you caught in time. Palace works under a just culture. We report to learn and prevent, not to blame. Tell the nurse or supervisor immediately, report the near misses too, and never hide, delay, or cover up an error. Every near miss you report is a free lesson that protects someone down the line. Speaking up is exactly what keeps the next resident safe. Even careful people make mistakes, and what you do next protects the resident. Check on and monitor the resident first. Their safety comes before anything else. Tell the nurse or supervisor immediately. Notify the physician as directed by the nurse, and document the facts, what happened, when, and what you observed, honestly, with no guessing and no cover-up. Acting fast and honestly is what protects the resident. The errors that happen most often are also the most preventable. Skipping the checks, identifying a resident by room number, grabbing a look-alike without reading the label, rushing, pre-pouring, documenting before giving, or staying silent about a mistake. Notice the common thread. Almost all of them come from rushing. Everyone is stopped the same way. Slow down and follow the steps. Who handles medications differs by setting, so know your role. In assisted living, trained team members usually assist residents with self-administration, bringing the labeled container, reading the label, confirming the resident, and helping them take it. They do not calculate doses or give injections; those go to a licensed nurse. In skilled nursing, licensed nurses administer the medications. When a task is outside your role, hand it to the nurse. That isn't failing, it's working safely. In both settings, the safety habits are exactly the same. These habits aren't just good practice, they're backed by Florida and federal rules. Skilled nursing must keep medication errors very rare and keep residents free of any significant errors. Assisted living follows Florida's rules for assisting with self-administration, including trained staff and watching the resident take the medication, and errors are reported to the state on tight timeframes, so a fast internal report lets the community act in time. Knowing the rule is good. Doing the daily checks is what actually keeps residents safe. Almost every medical error is preventable, and you are the safeguard that prevents it. Slow down, check, confirm the resident with two identifiers, communicate clearly, and when something isn't right, speak up. Reporting an error or a near miss is never a failure. It's how we protect the next resident and each other. This has been a Palace University training. Thank you.